Obsessive Compulsive Disorder. Obsessive Compulsive Disorder, often called OCD, is a mental health condition that affects how a person thinks, feels, and behaves. It is characterized by the presence of unwanted and repeated thoughts, known as obsessions, and repetitive behaviors or mental actions, known as compulsions. People with this disorder feel trapped in a cycle of obsession and compulsion that causes distress, anxiety, and disruption in their everyday life. Although many people may occasionally worry about germs, safety, or order, for those with obsessive-compulsive disorder these thoughts become so powerful that they dominate their daily routines. Obsessions are intrusive and persistent thoughts, images, or urges that repeatedly enter a person's mind. They are not just normal worries, they are distressing ideas that seem impossible to control. A person with this condition might constantly fear that they have forgotten to lock a door, left the stove on, or touched something dirty that could make them or their family sick. Even when they know that their fear does not make logical sense, they cannot stop the thoughts from returning. The anxiety becomes so strong that they feel they must perform certain actions to make the thoughts go away. These actions are called compulsions. Compulsions are repetitive behaviors or mental rituals that a person performs to relieve the anxiety caused by their obsessions. For example, someone might wash their hands over and over again to feel clean, or check the same door lock many times to make sure it is secure. Some people repeat words silently, count to a specific number, or arrange objects in a particular order until it feels right. These actions provide temporary relief, but the calm does not last long because the obsessive thoughts soon return. This creates a painful and exhausting cycle that can take up hours of a person's day. The exact cause of obsessive-compulsive disorder is not fully understood, but researchers believe it is the result of a combination of biological, psychological, and environmental factors. Studies show that people with this disorder may have differences in brain structure and chemistry, especially in areas related to decision-making and emotional control. Genetics also play a role, as the disorder tends to run in families. Traumatic or stressful life events, especially during childhood, can also increase the likelihood of developing obsessive-compulsive behaviors later in life. It is important to understand that obsessive-compulsive disorder is not a personality flaw or a lack of willpower. People with this disorder do not choose to think or behave this way. Their minds are caught in a pattern of unwanted thoughts and actions that feel beyond their control. Many of them are aware that their fears and behaviors are unreasonable, which makes them even more distressed. This awareness separates obsessive-compulsive disorder from conditions like psychosis, where people lose touch with reality. In OCD, individuals know their thoughts are irrational but still feel compelled to act on them. Obsessive-compulsive disorder can appear in many different forms. Some people have contamination obsessions and spend large amounts of time cleaning or avoiding anything they see as dirty. Others focus on order and symmetry, feeling anxious if objects are not perfectly arranged. Some experience doubts about safety or harm, leading them to check things repeatedly. There are also people who have intrusive thoughts of a violent or sexual nature, which cause deep guilt and fear even though they would never act on them. The disorder can affect anyone regardless of age, gender, or background. Living with this condition can be exhausting. People often hide their symptoms out of shame or fear of being judged. They may avoid social gatherings, school, or work because they fear losing control or being embarrassed by their behaviors. Over time, this can lead to depression, loneliness, and a loss of confidence. The disorder can also affect family members, who may struggle to understand why their loved one cannot simply stop the behaviors. Family members may even become part of the ritual by providing reassurance or helping to avoid triggers, which unintentionally makes the disorder stronger. Treatment for obsessive compulsive disorder focuses on breaking the cycle of obsession and compulsion. The most effective form of therapy is called cognitive behavioral therapy, particularly a method known as exposure and response prevention. In this approach, the person is gently exposed to the source of their anxiety but prevented from performing their usual compulsion. For example, if a person fears germs, they may be asked to touch a doorknob and then resist the urge to wash their hands. Over time, their anxiety naturally decreases, and their brain learns that nothing terrible happens when they do not perform the ritual. This process helps them regain control over their thoughts and actions. Medication can also help. Doctors often prescribe antidepressants, especially selective serotonin reuptake inhibitors, which help balance the brain chemicals involved in mood and anxiety. Some people benefit from a combination of therapy and medication. Support groups and education about the disorder are also important because they help people feel understood and less alone. Family therapy can teach relatives how to provide support without encouraging the compulsive behavior. Recovery from obsessive compulsive disorder does not happen overnight. It takes patience, practice, and persistence. Many people experience improvements in their symptoms and learn to manage their condition effectively with treatment. The goal of therapy is not to erase every unwanted thought but to reduce their power and help the person respond in healthier ways. With time, people can learn that they do not need to obey their fears and that they can live a meaningful, productive life despite having the disorder. Raising public awareness about obsessive-compulsive disorder is essential because misconceptions still exist. Some people use the term OCD lightly to describe being neat or particular, but real obsessive-compulsive disorder is much more serious. It is a painful and complex condition that requires understanding and compassion. When society learns to recognize the signs, more people can receive help early instead of suffering in silence. Obsessive-compulsive disorder also teaches us something important about the human mind. It shows how powerful thoughts can be and how much influence they have over behavior. But it also shows how strong people can become when they face their fears with courage and seek help. Many people who once felt imprisoned by their obsessions have learned to manage them and live full, happy lives. In conclusion, obsessive-compulsive disorder is a mental health condition that traps people in a loop of unwanted thoughts and repetitive actions. It is not their fault, and it cannot be controlled by willpower alone. With professional treatment, understanding, and support, recovery is possible. Therapy helps people break free from the endless cycle of fear and reassurance, teaching them that they are stronger than their obsessions. If you found this explanation helpful and learned something new about obsessive-compulsive disorder, please like this video and subscribe to the channel.